viewers, I hope all of you are safe. With this video, let me walk you through an important surgical concept that we encounter in medical coding. It's called as the global surgical package or the global period. So we see it is a package with reference to a surgeon. So the word global here means the complete. So the entire services that are related to a particular surgery, whether it is minor or major, is being bundled into a package. In the sense, it's a kind of a reimbursement package that is being provided to surgeons. Let's explore more about this. Well, this concept will also be divided into two parts. Come, let's explore about this global surgical package, which is often a source of confusion for many medical coders. And for the billers, many claims might be under this denial buckets due to this global package violations. And let's see how we can resolve such claims. Though I use the terms synonymously, now the package refers to the services, and these services are limited to a certain fixed time period. What exactly a global period means? It's a period of time starting with a surgery and lasts for a particular period after surgery. So the global period starts even before the surgery is being started. This is especially true in case of major operations like removing organs like hysterectomy or nephrectomy. For minor procedures, the global period includes the date of surgery and the period that ensues after the surgery. In a global period, there is a normal routine follow-up. Now, those routine follow-up services cannot be separately unbundled from this global period or from this global package. Let's have quickly the concept of Medicare. What does CMS say about global period? It's a period of time during which a physician may not bill for related office visits. Now you need to give attention to the words related visits. You will understand the concept well when we talk about the global modifiers. Certain modifiers should be used during this global period in order to bypass. When I explain about those modifiers, you will certainly understand the entire concept in a nutshell. The global period has distinct time periods. We can conveniently divide this global period into three phases as the pre-operative period, the intra-operative period, and the post-operative period. A medical coder who has underwent the basic medical coding training would well understand the meaning of those prefixes pre, intra, and post. Pre refers something which occurs earlier. Intra means within. So intra refers something which is inside. Post refers to something which has happened later or after a procedure or after a service. So we say as a post-mortem examination, which is an after-death examination, which is nothing but an autopsy. When you go by the literal word meaning of these words, you will understand the services that are included in each of those time periods. I'll explain further about the pre-op, intra-op, and post-op in the next video, but you just need to understand that the entire surgical episode is now being counted in days, and we call them as the global period. There are certain minor procedures for which the global period is 0, which means there is no global surgical package associated with such minor procedures. In general, we can divide the surgery or the procedures or the operations as minor and major. For example, when the physician does a skin excision, that becomes a minor procedure. Whereas a neurosurgeon performing a brain biopsy would be a major surgery. The time periods for both these procedures differ because the skin excision is a minor procedure and we have a distinct number of global period for a minor procedure, whereas the neurosurgery would have long days. Now let's see this breakup. For a minor surgery, the global period can be 0 to 11 days. Why is it 0? Because, as I said, certain minor procedures do not have any global periods. So patient gets his procedure done and he can comfortably leave the office or the hospital on the same day. This concept of global period is conveniently broken down to 3 phases. So for a minor procedure, you can have the preoperative day as 0 and the intraoperative day as 1 and the postoperative days as 10 days. Totally, you can have like 11 days. But you need to understand the question. Sometimes you would be asked, what is the total global post-operative days for a minor procedure? In that case, it is 10 days post-op. If you are being asked what's the total global days, then you should say it as 11 days. But if they specify as post-op days, then you should say it as 10 days. When we talk about the global periods of major surgery, now the major surgery will have the following breakup. But before that, you should understand, imagine someone in your family or in your and dear ones is going to undergo a major operation. At that time, you might have heard like the doctors would have asked the patient to come and get admitted 1 day prior to that of the surgery. So that 1 day previous to the surgery is of critical importance because the patient would be subjected to all possible tests and the anesthesiologist and cardiologist will have to give the clearance for surgery. So we call it as a pre-operative clearance. The patient will be subjected to a pre-operative examination. So for a major surgery, we have 1 day as pre-op. Now the importance of this pre-op visit is that many insurance companies would not allow you to have a separate EM service on this particular day because the patient is being admitted for a routine pre-operative service. As usual, the intraoperative day is 1 day and the post-operative period would be like 90 days. When we sum it up, you find that the total global days for a major surgery is 92 days. And if you have questioned what is the specific number of total post-op global days for a major surgery, in that case it is 90 days. Literally, you'll have to count each day and you'll have to ensure whether the patient is within the global period or the patient is out of the global period. If the patient is going to be there within the global period, then the insurance company has all rights to deny the services that the physician performs during this global period. Because you should understand that the surgeon is being given the compensation for his service for the entire episode of care to this particular patient. Whatever problems a patient encounters during the post-operative period will be the responsibility of the surgeon to address, unless the problem is unrelated to the surgery. And all routine visits, all routine complications will be bundled within this global period, and so a separate payment will not be allowed. If you think that the patient's condition requires a separate assessment and that the surgeon or the physician will need to be compensated, in those terms you will have to report the appropriate global modifiers, which we will discuss in the coming sessions. Trust this video helps you in a bigger way, and I'll see you in the next video. Till then, take care.